Welcome back, everyone. Today's show is all about living healthy, and we've got a bunch more healthy recipes coming your way in just a minute. But right now, you know, it's no fun living with pain. That's certainly not a great way to live. And we all want to be healthy and pain-free, and that's where Dr. Doug Gateman comes in from the Aascend Pain Institute in Appleton. Good to see you.
Morning.
Good morning. So what's our topic of the day, Doctor?
Well, we're talking about osteoporosis. Everyone knows what osteoporosis is, sort of.
Right. We've heard about it, and I know we all should be worried about it. Somehow I'm not really, and I probably should be, you know?
Yep. Well, in a nutshell, here's what it is. Our bodies always break down and make bone all our whole life.
Okay.
As we're growing, it makes more bone than it breaks down. As we get older, it breaks down more bone than it makes.
Okay.
So our bones get thin. Now, there's a bunch of different ways to test it. A bone scan, which most primary carers do at certain ages.
Yeah, about what age? I was just thinking that because I just went for a checkup and they didn't do it at this point. So
it depends. Some guidelines are 55, some guidelines are 60. It also depends on do you have it in your family.
Okay.
So family history is a big part of it.
Okay.
I tell my patients all the time, blame it on the folks because it usually runs in families. But I brought this along. I don't know if they can show that. This is a guideline. Sort of shows what people look like with normal bone. And then you have osteopenia, which is not osteoporosis. And then you have this section where your bone scan is less than 2.5. That's osteoporosis.
Okay.
Notice how the backs start getting a little more
Yes.
crunched forward.
Yes.
Okay. Well, what happens, we'll put this down. What happens is, this is your normal back. Okay. So the bones are nice and square. As we get older, the disc compress down. That can get that little lean forward a little bit. But also, as when people get thinner, this is actually what the bones look like normal. So nice and thick, but
Sure.
There's a bunch of little bones inside. The outside is nice and hard. This is actually osteoporosis.
okay.
There's not much in there.
No.
So what happens is people have what's called compression fractures. They fall down or just move certain ways, and this whole bone collapses down. What you see is a bunch of little bones inside. You have a bunch of broken bones. It hurts.
Right. Yeah.
So a lot of times to treat it just depends on the patient. If they can move, fantastic. Give it time, let it heal. If it can't, then what we do, we actually have special needles we'll insert in and then inject through the top cement. It's the same cement they use with artificial hips.
Okay.
So it fuses everything, and it doesn't hurt.
And
so
it makes a world of difference?
oh yeah, it's like they walk out the door, it's like pain's gone.
Really?
It's
Wow.
amazing.
Wow. So osteoporosis is one of those things, if you have it, it's not going away. You just got to be able to deal with the pain.
Yep. Well, with compression fractures, you have to treat it. Now, osteoporosis, you can actually treat it. There's medications out there to help make stronger bone. And if your body's not making bone, there's other medications out there that actually stimulates the bone growth cells.
Okay.
So that's what these are. Actually, this is osteoporosis. This is after a year and a half of some of the medications that will actually make it thick again.
Really? Wow.
Yeah. So there's medications out there that if you're not doing well on the normal stuff, it will really spin it up and actually make it much thicker. On top of it, that little person, when you show the little ladies and gentlemen bent over, a lot of times the muscles get laxed. So a lot of things we do is physical therapy.
Okay.
So that strengthens the muscles up, takes the pressure off. There's nice little braces out there now that come around the waist, actually come around the harnesses, like around the shoulders. And what it does, remembers them to sit up straight and actually
Yes.
stimulates the muscles to actually sit up. It strengthens the muscles. So there's a lot of things we can do. You just got to sit there and find out what you got.
And for people who are worried about it, go in and get that bone density test.
Yes.
You know, and
Yep.
take control of it now before that happens.
Start
Yeah.
young and
Yeah.
keep it going. Yes.
Yeah. All right. Good advice. Thanks so much.
Thank
Appreciate
you.
it. Great to see you.